Katie, so post-transplant, what does the diet look like then in a general sense?
Yeah, so post-transplant, if you don't have any delayed graft function, so if you're not familiar, delayed graft function when is the kidney is a bit slow to wake up. It's sometimes people refer to it as a sleepy kidney. With people with delayed graft function, you may need to continue limiting the minerals like potassium and phosphate until the kidney function improves. But for most people where they don't have delayed graft function, you can then reintroduce those high potassium, high phosphate foods you've been reducing, which is some good news we can provide. Then what we would be doing is making sure that your diet isn't too high in bacteria. The reason being is post-transplant, you're on quite high doses of immunosuppressants. And they do just that. They suppress your immune system, which places you more at risk of foodborne infection. One of the most common foodborne infections, sorry, not the most common, but one of the foodborne infections that we are quite concerned about is listeriosis. So we do recommend people follow what we call a low listeria diet, which is actually similar to what like a pregnant woman has to follow. And that's about limiting those foods high in listeria and other bacteria. So for instance, ready to eat meats, raw eggs, unpasteurized dairy foods, any raw fish, for instance, sashimi, any raw meats, and making sure that you are cooking your foods well, you're preparing them well, not keeping leftovers for too long, and really being careful when you're eating out. For instance, we would say to avoid any prepackaged salads. We just don't know how well they've been washed. We want to make sure that fruit and veg is washed really well. For instance, even if you're, let's say, having something like an avocado or a rock melon where you might not eat the skin, to still wash it well underwater. Otherwise, that knife's going to be going through it and that bacteria could be then going through the food. So we do recommend a low listeria diet. But in terms of how long you follow that for, that will depend on your individual transplant team's recommendations.
Yeah, exactly. And you get to come off the different dose of medications at different times to other people. Everyone's
Exactly.
individual, so you do really need to check in and make sure you're following their advice for sure.
That's right. Yeah. And that's for the more short-term recommendations. Then longer term, the medication you're on, it does place you at higher risk of other complications such as elevated cholesterol levels. It can also increase weight gain, can put you at higher risk of steroid-induced diabetes. So, and also osteoporosis. So for all those reasons, a healthy diet is really important post-transplant. It would be about avoiding too many foods high in saturated fat, limiting added sugars, continuing to limit salt in your diet, making sure you're getting enough calcium in, and really making sure you're following those healthy eating principles to prevent any of those complications down the track.